broadcast is now starting. All attendees are in listen-only mode.
Hey there. Hey everyone, how are you? Welcome to Beat the Bugs. It's Dr. Whitney here from Rooted. So I'm going to welcome you guys here. Thanks for coming. I want to just make sure you can see my screen. So if you can just type in, yes, you can hear me, and yes, you can see me. Yes and yes, that would be amazing. Just so I can make sure we're all good. Okay, make sure you're showing screen. All right, can you guys hear me? Couple of you here. Let's check it out. Okay, yes and yes. Thanks, Nikki. Awesome. Okay, perfect. Love you guys. Thanks for showing up. Thanks for coming. All right. So as usual, I'm going to be this is going to be quick and fun. There's going to be lots of stuff I want to go through, and you will get the recording after. So if you want to review anything and if you want to ask questions, feel free. I'm here to help. And if you want to clarify anything in person or via email, I'm here too. Awesome. Let's get this party started. All right. So here's a little bit about us. I am the one on the right, Dr. Whitney from Rooted Naturopathic Clinic in Barrie here. And there's Dr. Carrie and Dr. Katie. So we are the naturopaths at Rooted in Health. And so today we're talking about the immune system and what's going on, all about that. So again, we're going to be fast and fun, and hopefully we cover lots of what you want to know about to keep your family and you as healthy as possible. All right, so does your immune system need help? So here's a few things that I want you to kind of ask yourself, or if it sounds familiar, then maybe that's an issue. So do you have an increase in illnesses like colds and flus, ear infections, or does your family have that? Sinus infections? Are you slow to recovery, or you know when some people get a cold and it's like weeks and weeks of that lingering symptoms? How about chronic infections that never resolve, such as warts, fungal infections, cold sores? So any of that, infections just won't go away. Delayed wound healing, so you got some cuts and scrapes that don't heal very fast. Unexplained fatigue, and never getting sick. Actually, that's a really cool one that our professors talked a lot about. Was actually, it's, when someone comes into my office and they boast about, oh, I never get sick, I haven't been sick in 5 years. Actually, that's not we want your immune system to be kind of reacting to things. If it's never reacting to things, then that means it's like there's kind of like constant things that are getting in, and it's not creating any mucus to drain it. That's an issue too. So, and those chronic infections like warts and things. So when someone comes in and say, I have this on my foot and it would just never go away, then that's an immune system underlying issue that we're concerned about. So definitely we want to support the immune system, because our bodies are these amazing things that should be able to keep things at bay and keep everything in check. So so does your immune system need help, or what about your families? Like, does this sound familiar? Hey, Amy. Thanks for joining. Yeah, feel free to type in any questions or comments while you guys are here. I'll keep watching for those. Cool. So boost the immune system. Like, that's in the, that's a lot of people talk about that. Can we actually boost our immune system? So our immune systems are totally complex. We're still learning about how they work. And in relation to the other body systems, we'll talk about the gut and how healthy, a healthy gut and digestive systems are really important for your immune system. There's a lot, we're not just bit by bit by bit. Like, the medical system is pretty good at becoming experts in one area of the body, but we're all connected. So it's really important to look at the whole picture. So when I say boost, do I mean we're actually going to increase specific immune cell types? No, not really. What we're really doing is optimizing our immune function. So giving it the tools it needs to do the job it naturally wants to do. So we're going to talk about some of those lifestyle factors that you can do to help improve and optimize your immune system. We're going to talk about some of the diet stuff and some of the cofactors, vitamins, minerals that are important for your immune system to function properly. All right, so here, let's compare the cold and the flu. So cold and flu season is coming up. People are talking about getting their flu shot, et cetera, et cetera. So what's the difference? So we've got the common cold. It's caused by over 200 different types of viruses. They typically pass from hand to mouth to nose to eyes. So this is when you are out in the world and you are touching doorknobs and you are shaking hands and then accidentally, like wiping your nose or like eating something or popping in that gum before actually washing your hands again. Our immune systems are pretty great at fighting all of these things off. We're totally exposed to tons of microbes all the time. So the cold is over 200 different types. So less than 1% of cases lead to complications like ear or sinus infections. So that's when things just aren't resolved and they get worse, right? My daughter in her first year of life, she got a lot of ear infections, but it usually started from a cold first, right? She got really snotty and then she wasn't draining properly. Her ears, the tubes are more horizontal. So then she was getting more ear infections because the gunk just wasn't flowing. I mean, there's lots of, ear infections I could do a whole nother talk on, but just an example. So cold, you've got runny nose, sneezing, headaches, sore throat, coughing, low fever. Let's look at the flu. So that is only actually caused by one virus, the influenza virus. You'd get a runny nose, sore throat, and coughing, so that's similar. However, you're going to have a higher fever, muscle aches, little to no appetite, and fatigue. In kids, you might have vomiting, and it comes on quickly. And overall, you just feel much, much worse. So, it's something that your body will kind of run the course of, for instance. But when do we actually need to go to the doctor? And I talk about a medical doctor or a naturopathic doctor, your health, your nurse practitioner. So when do you actually need to see someone? So if your symptoms have lasted over 2 weeks, like your body should be able to bounce back under 2 weeks. If you or your loved one is elderly or immunocompromised, so has some sort of health condition that they are immunocompromised, or an infant, so we're talking little ones, then you would want to, see a doctor, seek care. A high fever that does not go down. One day I'll do a talk about fevers and children. Fevers are actually really helpful for our immune systems. That's our body's natural defense. It heightens up, it raises your body temperature to fight off those infections. So a fever is actually a natural good thing. And what we want to do is assist a fever, not just suppress it, because I know there's lots of fear out there with fevers and little ones. So I will at some point do a talk about fevers and little ones, because that's a whole other topic, or come talk to me at the office about it. Give me a call. But I do want to kind of just plant that seed that we do want to support a fever, as long as it's not a scary one, or too high or too fast, and your child's acting normal, then fevers are actually a good thing. But if a fever does not subside, go backward, then that's when to go to the doctor. If you suspect a bacterial sinus infection, so that can be very uncomfortable and it's just no fun. If there's any trouble breathing at all, that is a red flag. Let's have an issue. So we have a question. Hey, with a bacterial sinus infection, would you be seeing lots of blood coming out in the thick snot? It's yes or no. Not necessarily. There is a myth about, like, if you see green mucus, that's a bacterial infection. It doesn't necessarily mean it is. Most infections are viral. When we're talking about sinus, blood is more likely like your tissues being irritated, and weak blood vessels? So, I mean, that's a complicated question. And, would you go see a doctor? It really depends on if it's very uncomfortable, very painful, like you bend over and you're getting a lot of pain, and if it's not going away, then there are things we can do naturally, or perhaps you need antibiotics. So when are antibiotics necessary? Definitely we want to remain cautious around infants and the elderly who are at high risk for complications. So we definitely treat kids at the office, little ones, but if they are a baby, if we got a real fresh one, we want to be extra cautious there. A sinus infection that lasts longer than 7 days with pain and thick mucus, then that's no good. Strep throat, so severe sore throat, swollen lymph nodes, and an absence of cough. So antibiotics, a lot of people come to the office and they do not want to go on antibiotics. So we do have things that we can do instead of, and really we say, okay, here's your prescription, here's your treatment plan. If it isn't, this is kind of my rule of thumb, like if it's not better within 3 days and it's getting worse, then you probably need antibiotics. We want to have a grounded approach to health and natural health, but I can't solve everything with my magic toolbox. So sometimes we need antibiotics. Sometimes we need to go the medical route, and that's totally okay. Have my kids been on antibiotics? Yes. Yes, they have. I will admit it. And that's okay. I'm not going to beat myself up or, have mommy guilt about it. It's okay to use use the Western medicine too. I'm supportive, but definitely following that up with probiotics. So the antibiotics are ineffective against the common cold or influenza as they're not caused by bacteria. They're all viruses. So they don't change the duration or the severity of illness, and they have unwanted side effects. So, I know that people can get frustrated when they go into the walk-in clinic or the medical doctor and they're feeling awful and they want to feel better. They want something to feel better, and they think about antibiotic will help them feel better, and they get frustrated when their medical practitioner does not prescribe them an antibiotic. But nowadays, we're concerned about antibiotic resistance. So overuse and misuse of antibiotics is becoming an issue. So that's why using natural therapies is a much better first line for many concerns, and then definitely for common cold or influenza, because our antibiotics are not going to be helpful. So over-the-counter aid should not be used in children less than 6, as the harm outweighs the benefits. So again, you want to see a professional if your child is young, and someone who specializes in kids' health, like I do, or someone else. Okay. So stopping the cold before it starts, what can we do? An ounce of prevention is worth a pound of cure. So we all know washing our hands is super important. I shared a little live video this week about some tips of getting your kids to wash hands. We have a book at home called Germs Are Not for Sharing. So it's all about how to wash your hands and cough into your sleeve and your elbow. I switch up the soap so that it's kind of like a fun soap. It's like, ooh, I haven't seen that before. We use Daniel Tiger. He's a fun cartoon that's got lots of life lessons that are perfect for age like 2 to 3. And one is about, using the potty. Stop and wash and be on your way. So lots of fun ways to get our kids to wash their hands and remind them to do it often. So, and then not touching our nose and mouth. If you are out in the public, definitely washing your hands before you eat. You want extra prevention if you're high exposed area. So your schools, hospitals, airports, using the transit system. Lots of people are touching doorknobs, opening doors, and just that's the best way, is definitely to wash our hands. Another tip is secondhand smoke exposure. If your children or you are exposed to secondhand smoke, that increases your risk of getting sick. And that's a modifiable risk. So something you can kind of affect. Okay. I do yoga to relieve stress. Just kidding, I drink wine. That's fun. So just so stress. How does stress affect your immune system? Stress, when we're stressed, good stress and bad stress, your body doesn't know the difference between a good stress and bad stress. So like, yay, I get to the I'm getting married, or like I got a new car, or oh, I lost my job, or someone spat in my I don't know, coffee this morning, whatever. So bad stress and good stress. Oh yeah, Amy's saying grocery carts. Yes, totally. We touched those. So definitely, like, they're offering like those wipes now. You can wipe it down, or if it's just like the squirt stuff, sometimes I squirt into my hands and kind of rub that on my cart. They're gonna help a little for sure. Yeah, thanks, Amy. That is a high traffic, high hand area. Yeah. So the cortisol, this is your stress hormone. It suppresses the immune system. So if we are chronically stressed all the time, we're overly worried, we're a worried, kind of anxious, overwhelmed person, our bodies are constantly under stress, your immune system is not going to work as well. You will get less inflammation. So it decreases inflammation, but we actually need inflammation to fight off infection. That is your white blood cells and your immune system kind of surveying your blood to find what's going on. So we got to mop it up and get it away. Chronically stressed people are less likely to make antibodies to fight infection. There was an interesting, study around survivors of hurricanes and earthquakes. They looked at their immune activity. So they measured the antibodies and T cells and all those other microbiology crazy things. So in these hurricane and earthquake survivors, they had decreased immune activity. So just from going through that horrific, event, their immune systems were less effective. So think about it. Is your life stressful? Do you stress a lot about stuff? And then what kind of stress management techniques might work for you to help decrease, taking things off your plate, delegating, saying no, learning to breathe, going to sleep. So sleep and immune system is important. People who sleep less than 6 hours a night are 4 times more likely to get a cold than people who sleep for 7 hours. So they did this study, they compared them, and they tracked them how often they got a cold. So you want at least 7 hours so you can get 4 times less colds than those who are not sleeping as well. I feel badly for shift workers. You're always back and forth, and that is really hard on your systems for sure. Other studies, so chronic poor sleepers are more likely to fall ill. If you have 7 hours of sleep, it decreases your risk by 20%. So these are just statistics thrown out to you to say that, hey, your sleep is important. And creating a sleep routine and sleep hygiene, shutting off your phone 30 minutes, or you don't have to shut it off, just don't look at screens 30 minutes or more before bed. And the worse your sleep issue is, the more strict you need to be. Our bodies were designed in the caveman days. Nikki can't hear me. Can anyone else hear me? Can I just double check? Anyone? Can you say yes, you can hear me? Just double checking. Send all. Can you hear me? Can you guys hear me now? Yep, loud and clear. Oh, I came back. Okay, perfect. Thanks, guys. Okay, so sleep. So just talking about sleep. If your sleep is an issue, if you're having insomnia or it's harder for you to fall asleep, it takes you 20 minutes or longer to fall asleep, then that's a sleep issue. And I want you getting at least 7 hours of sleep a night for your immune system. Definitely kids need more sleep than that. And we want to foster those good sleep habits. So I was saying low lights before bed. I want you to shut off that phone, not using that before bed, and create some routine. Maybe it's some yoga, stretching, or reading with a low light, something that doesn't activate your brain too much. Have a sleepy time tea, chamomile tea. So there's lots of great ways of getting sleep, working on your sleep routine. And again, the more severe your sleep issue, the more strict your bedtime routine needs to be, at least, for a month till you get into a better routine. So immune system and sleep, that's important. What else can we do? Exercise. Oh, she looks a little scary. So moderate exercise 3 to 5 times per week enhances the immune system. So our bodies are pretty awesome. We know that exercise, it actually improves your sleep. So, hey, here's another way of getting a better night's rest, is to put in some sort of movement into your day. And if you don't like the word exercise, you can call it movement. Exercise also increases your body temperature, so almost like a mini fever. So it is increasing that body temperature to get rid of the bugs who are not supposed to be there. So that's another way. It decreases cortisol, so our stress hormone, and it improves circulation. So our immune system is carried around within the lymph, the lymph flow. So we talk about lymph nodes, the lymph system. That lymph system doesn't actually have a pump like your circulatory arteries and veins system has. The heart, which pumps the blood around. Your lymph system does not have a pump to do that. So moving our body, and the more we move our body and get massage and do dry skin brushing, for example, these things are going to help your lymph flow better, which helps take up the debris and move it out. So exercise, definitely something, and movement you want to incorporate into your life. We all know that that's, we all know we should move more. But even if it's 10 minutes, 3 times a day, right? That half-hour walk a day has proved to be amazing for many health issues. So just seeing where you can sneak in your exercise. Diet. All right, these guys, this looks good and healthy and lots of good foods there. So what we want more of, we want more fruits and veggies. So the colorful rainbow, we know that when we eat a wide variety of fruits and vegetables, when we switch things up, we are giving our body a wider variety of vitamins, minerals, and nutrients. If we stick to the same 3 vegetables, 2 fruits, because we're picky eaters, because we're just in a rut, then our body is going to be missing some sort of nutrient that it could have use for. So we want a rotation diet. Like, I love to have 3 different breakfasts, 3 different fruits going on in our, at least 3 or more going on in our kind of rotation. So we're not always eating the same foods. Protein is really important to produce our immune cells and all the things that we need. So we need proteins because we break those down into amino acids, and then our body builds those back into antibodies, for instance. And an antibody is something that is like your little army against the viruses. So we need good protein. If you are getting sick a lot, I want you to make sure that you are eating protein often, at least every day, maybe with every meal. And it doesn't necessarily have to be meats. We can use vegetarian protein. So there's lots of different choices out there. The warm foods. As we head into the winter months, I like to encourage lots of warmer foods. They're easier to digest. So soups and stews and stir fries versus salads, smoothies, etc. So again, it takes our body's energy to kind of warm up a food and then break it down and digest it. So we look at Chinese medicine a lot in our practice in naturopathic medicine, and they talk a lot about warming foods, which are more nourishing, and that you can get more minerals and vitamins from your warm foods. So this is something that you can definitely do as we start to move into fall is to get those soups and stews and warm foods in you. It also helps with secretion. So if you do have a cold, have you ever noticed, I notice when I go for, does anyone like pho soup? I know the Vietnamese say pho. Okay, so whatever, the noodle soup, rice soup, I eat that, I love it, and my nose starts dripping. So whether it's something, within the soup or is it actually the steam inhalation, like I'm sitting over this huge bowl of soup and I'm inhaling the steam. So this can help with your mucus, and the more kind of drainage you're having, like that's actually good. We want our body to drain out stuff. So hopefully that kind of made sense. We want less sugar. So sugar does depress the immune system for a short amount of time. So does alcohol and processed foods. So now again, I'm not saying never have sugar or never have alcohol or processed foods, but if you are someone who is getting sick all the time or your kids are, then let's work at reducing. And reducing does not necessarily mean never, as I just said, but maybe it's let's cut it in half, or let's have our sugary treats 3 times a night instead of 7, right? So it's, again, choose your own adventure, bit by bit, and depending on how severe, how much you want to address the issue is how far you kind of go with that. Okay. Yeah. So, okay. So what if you're sick now? Now what? Let's talk a little bit about supplements. And I want to just give a disclaimer here that I'm going to talk about them in generality. For you, I want you to make sure they're right for you and talk to your healthcare provider, your naturopath, and to make sure that they are okay for you so there's no concerns. All right. So just saying that. All right. So vitamins and minerals, I'm just going to quickly go through some of these for you. So vitamin A, the evidence. So we're going to talk about moderate, weak, or great evidence for colds and flus. So it's a moderate, it can help. There's some evidence. Grade D safety. So it's not, so a grade A would be no problem, no problems, super, super safe. Vitamin A is a grade D because it is harmful in pregnancy, so we don't want to overdose. It's a fat soluble vitamin, so your body stores it. If you have too much, you can have vitamin A toxicity. So it's not something we want to do for long term, but I do use it in short term doses for immune system issues or if you're getting sick. So it's really important for healthy immune systems. It can increase your resistance to getting infections, and a large dose at an onset of flu can dramatically improve symptoms. So this is something that we do use, again, with caution. It's not a long-term thing. If you want to get vitamin A in your foods, you're looking at kale, squash, carrots, those orange vegetables as well. Certain types of vitamin A, you want to be careful if in smokers or a history of smoking, that is definitely not good for them. So we don't want to give vitamin A to our smokers. Okay. Question, Christine, will you be providing a copy of the slideshow after the webinar? I'm going to send you a link to this after so that you can look at it after. I don't have a copy of the actual slides, but I will send you a link and then you can look at it later. Cool. Vitamin C. Again, the evidence is moderate, so it's not weak. You could definitely use vitamin C. Safety, grade A, no problem. Definitely the side effect of too much vitamin C is diarrhea, so we want to space out our vitamins C throughout the day. There was some studies that say it does not really have an effect on prevention of colds and flus, but a moderate dose at onset can decrease duration by 1 day, reducing symptom severity. So, if you're feeling awful for 5 days and you feel awful for 4 days, that's a 20% improvement, right? So, all right, I could take that. Foods are citrus, oranges, berries, pineapple. Vitamin C is a potent an antioxidant, so it is helpful. And do I give my kids some vitamin C? Yeah, I usually give them a little bit of a chewable vitamin C. You want to brush your teeth after a chewable vitamin C because it may break down enamel because of the acidity. But it's not harmful, grade A, no problem, and it may help, especially at that onset. And when you are sick, you can take a lot more vitamin C than regularly. So I do dose higher when we're actually sick, but it depends on how big you are, the weight of your kids, on how high we're actually going to go. Vitamin D, so totally important immunomodulator. So it helps modulate our immune system. Moderate evidence for colds and flus. The safety is a grade B. So not A, because it is, again, it's a fat soluble vitamin, so our body can store it. Vitamin D toxicity is very unlikely in Canada because we do not get enough sun exposure during the year, during a whole year. So people with low levels of vitamin D were 40% more likely to have a recent cold or flu than people with adequate levels. Right? So that's almost 50%. StatsCan, 40% of people are below the cutoff. Most of us are vitamin D deficient. If you do not know if you are, that is a blood test that we can do at the office, or your doctor can do. It's not currently covered by OHIP unless you have osteoporosis, rickets, or you're on a drug that may reduce the absorption of vitamin D, or if you have a history of vitamin D deficiency. So the general public, if we want our vitamin D levels tested, our doctor will have us pay out of pocket. So you could pay out of pocket with your medical doctor or your naturopath. It's around $35, I think. And that will tell you what your levels actually are, which will help us know how high our dose needs to go. Because the Health Canada recommendations are conservative because of that grade B, like the safety. But most of us are deficient, so we do want to get everyone in the family on vitamin D to help. Zinc, so strong evidence for zinc. It is a grade B in safety because zinc is something you don't want to use for a long time, because if you are on it for months and months and months, it deplaces copper. So another important mineral, trace mineral. So it's something that we use in kind of shorter bursts. It is an essential nutrient for your immune system, immune cells and mucous membranes. It can reduce the severity and duration and incidence of a common cold. So it is something that we want. You can get that mostly in grains, oysters. Yeah, good luck getting your kids eating oysters. There are zinc lozenges. You just want to be cautious of the sugar content in that. There used to be a cool product called, what was it? Zinc Drink. So I'm not sure if they sell that on the shelves anymore, but it was a liquid zinc that was, easy to get in your body, give to your kids. So you may find it more pure and it didn't have as much sugar. But, push comes to shove, if we want our kids to be healthy, we may do a zinc. But again, be careful of the dosage, especially if you're doing it with kids. You don't want to go too high. So how about herbs, botanicals and herbs? So we're just going to cover a few herbs that would be helpful. Echinacea, so the evidence, moderate, weak. It's a very safe herb. That's a small effect in preventing colds as well as decreasing severity. So echinacea is something that I don't use as a prevention, but more at the first sign of a cold, then we can use some echinacea. Ragweed allergy. If you have a ragweed allergy, you probably don't want to take echinacea because you may also be sensitive to echinacea. Oh yeah, that's that beautiful pink flower there. Oil of oregano, some people love it. So the evidence is weak, so there's not a lot of studies to support it. However, so few human trials. There's why we don't have strong evidence, but there are people who swear by it. It's antiviral, antibacterial, and also strong. So it can kill good bacteria in the digestive tract. So if you are kind of using this as your go-to all the time, then you may be affecting your digestive system. I alluded to the fact that your digestive system is really important for your immune system. About 70% of your immune system is in your gut or even higher. So we need a healthy gut and healthy digestive tract and good poops if we want a healthy immune system. So someone comes to my office with chronic infections, I do want to look at their immune system, or sorry, their digestive system and their diet as well. Oops, I pressed a button. Now I'm afraid what it's going to do. Oh, it's doing my camera. I'll turn that off. Elderberry. I love this one for kids. It actually tastes really good. The evidence is moderate. It's a grade A safeties, antiviral, immune modulating. So you can buy it in the syrup. You find in teas, homemade gummies for kids. A mom in my office this week said she made her own elderberry syrup. So I've never done that, so I can't give you advice on that, but our kids do like it. So that is kind of one you can look at the health food store as well for. Andrographis, this is a cool herb. No long-term use, but you can use it acutely. It decreases the severity and duration of colds. So it's best to start as soon as your symptoms appear. So have it on hand and then you can start then. And it's a pretty cool herb that not a lot of people have heard about, but yeah, that's a good one. So what else can you do? Some hydrotherapy, so saline rinse. So this is where you're using like a neti pot or a Neomed rinse to rinse out your nose with the saline. You can buy those from the health food store, or most pharmacies have them. Even doctors' offices are giving them away now. Steam inhalation. So that's where you boil some water in your teapot, put it in a bowl, put a towel over top, and you're inhaling the vapors. You may put a drop or two of an essential oil, and really the steam is going to help produce that drainage and drain things out. Contrast shower, so that's where we go hot and cold, hot and cold. What that does is it again pumps your venous system to dilate and constrict back and forth, which helps the immune system, the lymph system pump along. So this is something you could definitely do in the shower as a prevention. I usually tell patients to go back and forth 3 to 5 times. So you have like your hot shower, like wash one body part, then do a cold blast for 10 seconds or as long as you can kind of handle it, and then go back to hot. And then, so hot's longer, short, cold, hot, long, short, cold, always end on cold. And you'll be like, oh my God, that sounds awful, but actually it feels quite invigorating at the end of your shower to end on cold. And you're like, it's great for your lymphatic system. Warming socks. Oh yeah, I forgot about these. This is a really cool trick that at the start of a cold, what you do, and you can do this for your kids, too, is at the start of a sickness, you are going to take 2 pairs of socks. One is nice and thin and one is kind of thicker, woolly. The thin socks, you're going to get wet. Wring them out and then put them on your feet. So you're putting on wet socks. Sounds gross. And then you put on the dry, woolly, warmer, bigger socks over top. And then you go to bed. What that does is helps draw heat out of your head and the head cold, and can really help prevent a cold, stop it in its tracks. It's kind of a cool old hydrotherapy trick. So it is really helpful. And yeah. So just some more like eating for your cold and flu. So if you have a cold and flu, we want to reduce that sugar and caffeine. Both can suppress your immune system. We want to eat less dairy because dairy can encourage more mucus formation. So if you're already pretty mucusy in your head, then we don't need more. We want to give you more fluids, so thin out those mucus secretions, prevent dehydration, have more warming soups, stews, steamed vegetables, and protein. Chicken soup, and yeah, more chicken soup. There are studies about that having beneficial medicinal activity and reducing symptoms of colds and flus. So, I mean, we're talking ideally, okay, ideal world, you're having like a homemade kind of chicken soup rather than the Lipton noodle soup, which is delicious, but I don't think that's what they were testing. Cool. Other stuff, probiotics. Yep, totally. Probiotics are really important. We wanna take those. Other cool home remedies: so slicing an onion, putting in some honey, and you're making your own cough syrup. So definitely not with kids who are under a year old. So no one under 1 year of age. You can't use that with them because they can't have honey. But yeah, there's some studies that have shown like honey or agave could be used as cough syrups. So definitely check that out. Adding in the onion, maybe even garlic. Very cool. Ginger, lemon, honey tea. So lots of, in the Chinese, they use a lot of warming herbs. So ginger, cayenne, cinnamon, those kind of things, warming type herbs to help warm the body, stimulate the immune system. So making your own ginger, lemon, honey tea is lovely. How about a natural chest rub? So using a castor oil or other massage top oil or olive oil, coconut oil, and then drops of essential oils. There's lots of essential oil companies these days, so they would probably have their own remedies. But instead of using Vicks, which doesn't always have the best ingredients, you could make your own. Totally easy. Cool. So what to do? So we want to sleep as much as possible, as soon as possible. If you or your kids get sick, eliminate that sugar, junk, and processed foods. Try out some of the supplements and herbs, warming teas, and lots of water. And then what can your naturopath do? So we are offering personalized immune system checks right now. So it's 15-minute immune kind of checkup. Let us know that that's what you want to do. Kind of put that in your notes if you book online. And what we're going to do is assess where you're at right now, what your exposures are, and give you your plan that's specific for you, your health, and what's going on. We can give you recommendations on supplements. So no more wasting money on things that don't work, because we definitely have all done that. Buy a supplement and then it just sits on the shelf or it doesn't even work. You want quality stuff. So acute care for you and your family during illnesses. So if you don't want to go to the walk-in clinic because you don't want to wait for hours, or you want to try something naturally in the meantime, remember, if it's a cold or flu, your antibiotics aren't the go-to. So if you want something else to do in the meantime to make you feel better, we can help with that. And then IV nutrient therapy. So this is where we are right now. We have a special going on for the month of October, 10% off of our immune system bag, where we give your body immune system, give your body the nutrients it needs. So it's got some vitamin C, it's got some multi-trace minerals like zinc in there and your body absorbs, 90 to 100% of the vitamins and minerals through the IV in your veins, versus orally where maybe we'd absorb about 40 to 60%. So, yeah, so if that's something that we definitely use IV nutrient therapy to treat if you are sick. If you're chronically sick, this is definitely something we would talk about for you, and as prevention as well. So some people are coming in once a month during the winter. And then if you're about to go on airplane, you want to stay well or just keep up your energy. So definitely talk to us about that if you are interested in kind of improving your immune system even further. And a good cup of tea. Yeah, we have tea at the office, so definitely. We got this really good kick your cough tea So it's really helpful for coughs as well. Some herbs that you normally didn't see. Definitely, if you want to learn more, you can book your appointment online. We are here for you if you want to do that 15-minute, so not that free one that you can see below, but a 15. If you're already a patient, then that's where you can do that immune system check. If you have not become a patient before, then you do need to go through the intake hour appointment or 45-minute for a kid so that we can get you hooked up. Yeah, so thank you. There's me and the kids. I want to thank you all for joining me today. Guiltless Grace, so that's my Facebook group for moms, how to raise healthy, happy kids without the mommy guilt. So definitely join me there if you're not already a member. And then I just wanted to also mention Meals for Munchkins. So this is kind of a foundational program for my patients and others who want to get their kids on the right track for eating well. So this is for kind of 1 to 4 year olds because we know, we talked about diet a lot. So a healthy diet is important. So if you have any questions about that, let me know. I did go fast today, but I will send you a copy of the webinar. And yeah, thanks for joining me tonight, you guys. If there's any last questions, let me know. Thank you. Thank you. Perfect. Yeah, Nikki, see you Friday. Okay, cool. So any last questions, feel free to email me. Thanks again for joining me, and everyone go get some sleep. That will be good for our immune systems. All right, talk to you later. Bye, everyone.